the big C word, as you know, Keith, really scares patients. And you have to understand that in the prostate world, the majority of cancers are not going to be dangerous. Uh, Europe, as well as myself, we watch a lot of patients with 3+4. I personally believe that the future of prostate cancer is going to be genetics. And I don't mean family genetics. We're already learning, and thanks to Dr. Hessler, the pathologist, he's the one that got me on this in 2012, long time ago. We started pulling gene profiles on our patients that had a Gleason 3 and a Gleason 4. In other words, is this a good 4 or a bad 4? We're learning that people actually have 4s that act like 3s. So do you really need to give them therapy? Do they really need to be treated? So my philosophy, Keith, is stay as natural as you can for as long as you can. It's kind of like what you do. It's the testosterone thing. Oh, you got cancer. You can't take testosterone. Well, you and I, we're following so many patients with Gleason 3 that are taking testosterone. I think I've lost count. And nothing's happened to these people. Their quote unquote lesions don't grow because Gleason 3 cells take over 400 days before they duplicate themselves. And by patients taking testosterone, it does not accelerate that growth rate.
If anything, it inhibits prostate cancer cell proliferation. So it's the lower levels, the men that don't get testosterone, that are probably going to progress, according to the medical studies, not the men on testosterone.
That's exactly right. And of course, in all honesty, that's a reason that Keith and I do some biopsies, because we honestly want to know, yes, this is abnormal. Is it all three components? And that's why the precision biopsy is so important. You don't just, put a bunch of needles in and say, come back next year because we didn't find anything. And just because you're on testosterone therapy, I think you should be watched. But once you know what you've got, we're operating in a safety mode. In other words, we know what you've got. We're following both your T and your MRI. And if it does change, we're going to see it. We will see it.